Washington Journal continues.
And Stephen Moore joins us here on Washington Journal, a senior economist with FreedomWorks and regular contributor to a number of news networks and a former economic advisor to the Trump campaign and the Trump administration. But here this morning in your role as part of one of the authors of a study by the National Bureau of Economic Research, a final report card on the state's response to COVID-19. First of all, the NBER, the National Bureau of Economic Research, what is that?
Well, first of all, thank you for C-SPAN. I just love watching Washington Journal, and a privilege to be on. National Bureau of Economic Research is one of the most prestigious kind of economic journals that publishes a lot of studies about what's going on with the economy and what's going on with society. And so it is very well established and, as I said, very well respected.
Your study is a final report card indicating, and I think we actually talked about some of this during the course of COVID, that you've been looking at issues related to how states responded to COVID. You look into three areas in particular and compare them state to state.
Yeah. Let me just back up 1 second. You know, I think one of the things, we did a lot of things right and we did a lot of things wrong over the last 2 years with respect to COVID. This was the first killer virus that we've seen in 50 years. So people and politicians were in a bit of a panic back in March of 2020 when this happened. So mistakes were made, for sure. But one of the things I think that happened that I think was a right decision was early on, and I was working with Trump at the time, the president made a decision to really let the states decide their own mitigation strategies. And I think that was right. You know, we're a country of 50 states. We believe in federalism. Obviously, there were federal guidelines, but states used all sorts of different approaches to dealing with COVID. So the purpose of this study was to say, okay, what did the states do right? What did they do wrong? Which ones got it right and not? And these three metrics that you mentioned, we looked at were, one, most importantly, how did they do in terms of reducing the mortality rate from COVID? Because obviously keeping people safe and alive was the most important criteria. But then, of course, how did they do in terms of keeping their businesses open and keeping people out of unemployment lines? Did they keep their economies functioning? Because you can't have a society if you don't have people working and businesses running. And then third, how did they do in terms of keeping their schools open, allowing kids to go to school? My own opinion, having really looked at this evidence over the last 2 years, shutting down schools was a really tragic mistake. We should have never done that. Kids were never vulnerable to COVID. Someone over the age of 65 was 1,000 times more likely to die from COVID than a school-age child. So we looked at those things. You know, did you keep your schools open? Did you keep your economy functioning? And were you able to keep your death rates low? And we put this metric together, and that's the basis of the study.
And in terms of education, the shutting down of schools, do you think now that school systems across the country, with the benefit of hindsight, look at it now and say, yeah, that was a mistake to have shut down for a long period anyway?
So this is the very reason we did this study, really, is to say, okay, if we had to rewind and we know, if we knew then what we knew now, what would we do differently? And I really pray with this study, people will look at it, and politicians and state officials, and say, okay, here's what worked and here's what didn't work. And look, the evidence is really pretty crystal clear that shutting down schools has had a really negative effect on children in terms of their economic. When you're talking about a third grader losing maybe in some cases a whole year of schooling, that has potentially not just short-term but long-term, impacts on their academic and emotional progress as children. And so, no, we should not have shut down school. I mean, look, certainly in the first couple of weeks when COVID hit and we didn't know what we were dealing with, taking that kind of pause made sense. But no, we should not have kept schools shut down, and hopefully we will never do that again, because there will be new variants to COVID. I just got COVID 3 weeks ago, and I thought we were done with this. And so we will see new variants. And just the other day, Philadelphia announced new mask requirements and things of that nature. So the purpose of the study is to look at what happened in Florida versus California, look at New York versus Texas, what worked, what didn't. And the other kind of major takeaway is that lockdowns really weren't very effective as a mitigation strategy, but they did a lot of damage to their state economies.
And to do this, you assigned each state a letter grade in terms of those three areas and the scores that you concluded with a letter grade.
Yeah, and so the states that finished in the top, I'm going by memory here, but I think I have it right. The number one state was Utah.
Right.
I think the second state was either Nebraska or Vermont. And then you had states like South Dakota.
Yeah, I pull up the report
you
here.
got it there.
Utah's A+, Nebraska, Vermont, Montana, South Dakota, Florida, New Hampshire, Maine, Arkansas, and Idaho in the top 10 in terms of the cumulative score of all three of those categories.
Yeah, and the one that kind of stands out there to me, of course, is Florida, because Florida's our third largest state. And Florida was really criticized. Governor DeSantis was very criticized at the beginning. They even started calling him Death Santis, and how dare you open up the beaches and the hotels and things. And what's really interesting about the study is that if you compare two really big states, California and Florida, two of our three largest states, they used diametrically opposite approaches to dealing with COVID. So Florida was, I went to Florida many times during 2020-21. It was pretty much open for business. The beaches were open, the hotels were open, the restaurants were open. Now, people were wearing masks and people were social distancing. Whereas when you went to California or New York, it was basically everything was just shut down and people were kind of locked in their homes. And then you go, okay, well, what happened? Well, it turns out one of the things we do is we adjust the death rate for what we call comorbidities, that are what are the factors that were associated with people dying. Well, age obviously was the major factor, but other health problems like diabetes, if you had diabetes or emphysema, or you had other kinds of problems, heart problems, yeah, you were vulnerable to COVID. And obesity was also a big factor associated. And anyway, my point is that Florida actually had almost exactly the same death rate as California, and yet Florida did not, undermine its economy. They didn't throw their businesses into bankruptcy, and they've come out of COVID in much better shape than a state like California has.
Steve Moore is our guest here to talk about this new study that he's part of with the National Bureau of Economic Research on how states did during COVID. 202-748-8001 is the line.